Greetings and welcome to our third video in our heart-centered wellness series, Being Intentional About Depression. I am the Reverend Dr. Shalita Mira, psychologist, licensed clinical social worker, and senior pastor. And we are continuing our focus on equipping our communities with wellness strategies for the mind, body, and spirit. In this particular episode, we are going to talk about suicide, suicidal ideation, some warning signs for suicide, and we're going to finish today's episode reviewing the biological etiology of depression and discussing some coping strategies and a challenge to you to create a wellness plan for any depressive symptoms that you're experiencing or a preventative wellness plan so that you can guard yourself from depressive symptomology. So let's spend a moment talking about suicide. As I stated earlier, it is so important for us to have conversations about suicide, especially when we are doing educational pieces and educational moments on depression, because they are so closely correlated. Every 40 seconds, I want you to think about that. Every 40 seconds, someone in the world dies by suicide. And every 41 seconds, someone is left to make sense of the loss of their loved one. Suicide is the fourth leading cause of death in children aged 10 to 15. And it's the second leading cause of death amongst adolescents and young adults between the ages of 15 and 29. And the rates of suicide are 3 times higher in females, but the rates of completed suicides are 5 times higher in males. There are warning signs for suicide, and I want to share a few of the warning signs with you because individuals who are experiencing suicidal ideation often exhibit some signs or some symptomology. So let's look at a few of those. So the individual may talk about suicide. Maybe they're acquiring the means to commit suicide. They may be hoarding certain lethal substances, maybe acquiring more firearms or preoccupation with knives. They're withdrawing from social contact. Maybe you notice that they're having mood swings or a preoccupation with death, dying, or violence. Maybe they've expressed feeling trapped or hopeless about a situation, sharing that maybe they would be better off if they were not here. You may even observe an increase in the use of alcohol or drugs, some changes in eating or sleeping patterns. You may note a lack of self-care in that the normal grooming, the normal motivations to care for well-being, such as medical care, is not being attended to. Maybe they're risky or self-destructive behaviors or self-neglecting behaviors, giving away belongings, and then saying goodbye to people as if they won't be seen again. These are just a few of the warning signs. And it is extremely important that we highlight how depression and suicidality is impacting our African American youth. Because in 2017, which is less than 10 years ago, the U.S. Department of Health and Human Services, Office of Minority Health reported that suicide deaths among Black females aged 13 to 19 rose 182%. 182% between the years of 2001 and 2017. while the rates among Black teen males rose 60% during that period. And this is just looking at data from that 16-year time frame. Now data is being collected so that we can see the effects of COVID and depression on suicide. And so there'll be some new data that will be emerging here in the next few years. However, it is important to note that in those years, for Black females between the ages of 13 and 19, suicide deaths rose 182% and 60% for our Black teen males. We must begin to have conversations around depression and suicide so that our communities can have the knowledge, the resources, and also the motivations and positive mental health, help-seeking attitudes so that we receive the services that we need. So some may be asking, what are some of the causes of depression? And I want to spend a moment kind of talking about the etiology of depression, because the causes can be genetic, they can be biochemical, they can be physical, they can be psychological, and social factors. So it doesn't have to just be something that's going on in one's environment or trauma. There are other etiologies or other areas that motivate the manifestation of depression. So let's look at genetics for just a moment. An individual is 2 to 3 times more likely to have depression if they have a first-degree relative with depression. So that's that genetic component. Biological factors, when we think about injuries to certain areas of the brain, such as the prefrontal cortex or the basal ganglia. Also, there may be certain disorders that impact serotonin and neuroendocrine and hypothalamic pituitary adrenal hormones and those regulation systems. Stress contributes to abnormal cortisol levels, which can also have a biological or be a biological trigger for depressive symptomology. So we see genetics, we see biological. When we think about psychosocial factors, there is a relationship, even though there's still research being conducted on it, but there is a relationship between psychological stress, stressful life events, and the onset of depression. And then there can be some pharmacologic factors. So depression can be the side effect of certain prescribed drugs or medications. And so it's important that we understand that an individual may not have experienced any depressive symptomology, but become the age of 45 and have an onset of depression or depressive symptoms, and it may have nothing to do with their social environment. It may have everything to do with a new medication they have been prescribed, or a stressful life event, or there can be injuries or other biological disorders, or there can be the genetic component. So you may be wondering, Dr. Mira, what do I do? I've listened to all of the information that you provided thus far in this workshop, and I have been experiencing some of these symptoms. What are my next steps? So it's important to know that depression is diagnosed after a thorough assessment is completed, and then the appropriate treatment is determined and prescribed. So The first thing you want to do is take the information that you have learned thus far, and if there are some manifesting symptoms, you want to reach out to the appropriate provider. You may want to schedule an appointment with your medical doctor and have your medical doctor do a series of tests to make sure that there is not a biological reason for the onset of the depression. Your primary care doctor can also review your medications, if you're taking any medications, or any other over-the-counter supplements, and have conversations with you, because of course we always want to rule out the biological triggers or the biological reasons. We want to rule those out first. Once we know that there's nothing biologically contributing to the depressive symptoms, then you can reach out to a psychologist or a therapist or even a psychiatrist so that a series of assessments can be done. And those can be psychological and or psychiatric evaluations. Some of the screening tools that we use, for example, for children, we would use a screening tool called the Child Behavior Checklist. But then for an adult, we may use the Beck Inventory Scale. We may use something called the PHQ-9. And the goal is to determine the symptoms, the onset of the symptoms, the duration of the symptoms, and how the symptoms impact normal daily functioning. And then from there, we also want to learn about what's going on in your environment. What is your work-life balance like? How are family relationships and communication? We do a thorough assessment, biological, psychological, social, and spiritual. And then the goal is from there to develop a comprehensive treatment plan that includes both the individual, the family if necessary, and medication if necessary. Some of the interventions that we use are cognitive behavioral therapy. We may use interpersonal therapy, and these are some of the individual forms of therapy. There are many, many others. I'm just giving you a few examples in this brief talk. And there are some effective antidepressant medications. You have Paxil, you have Zoloft, you have Prozac, you have Wellbutrin. But you want to be very careful with the medications that you're taking. You want to know the side effects. You want to know the effectiveness. You want to know if it's right for you, right? So you want to have conversations with your medical provider. You also want to make sure that you combine your medication therapy with the appropriate talk therapy, because while medications will help minimize, reduce, and in some cases eliminate some of the depressive symptoms, if it is social, if there's trauma, if there's abuse, if there's something there that needs to be processed, purged, healed from, the medication can't do that part. That part comes through the use of the talk therapy modalities, the exploration of the historical trauma and how that historical trauma plays a part in my daily life through fears and phobias and anxieties and negative self-talk. How historical patterns, right, of abuse or neglect or unrealistic beliefs, how all of that plays a role in how we function daily, our stress levels, our self-care, how we see ourselves in the world. All of those things are explored in the context of the talk therapy modalities. So I am an advocate of both talk therapy modalities and, if necessary, the appropriate antidepressant medication.